Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Start by changing the way you look at acne. Do not see it as dirty skin. Do not reduce it to a cosmetic inconvenience. See it as a small inflammatory system operating inside the pilosebaceous unit. Oil, dead skin cells, keratinocytes, bacteria, immune signals, hormones, and metabolism all interacting in a tight space under the skin. Why does that matter? Because if acne is only treated as a surface problem, we miss part of the conversation happening underneath. The National Institute of Arthritis and Musculoskeletal and Skin Diseases describes acne as clogged follicles where sebum and dead skin cells trap material inside the pore. Bacteria then grow in that environment and inflammation follows. Redness, swelling, heat, pain, and lesions. Now bring magnesium into the room. Not as a magic eraser, not as a replacement for dermatologic therapy, and not as a promise that every breakout will disappear. Use it more intelligently than that. Think of magnesium as a regulatory mineral. Ask, why would a mineral involved in hundreds of biochemical reactions matter to inflamed skin? How could something known for muscles, sleep, glucose handling, and cellular energy connect with clogged pores on the face, chest, or back? Here is the central idea. Acne is not caused by magnesium deficiency alone, but magnesium may help reduce some of the internal pressures that make acne harder to control, especially inflammatory tone, insulin signaling, stress physiology, oxidative burden, and barrier recovery. The NIH Office of Dietary Supplements notes that magnesium is a cofactor in more than 300 enzyme systems, including reactions involved in protein synthesis, glucose control, blood pressure regulation, energy production, DNA and RNA synthesis, and glutathione synthesis. So listen closely. Do not chase magnesium as a trend. Use it as a tool. Ask better questions. Why is the skin inflamed? How is the diet affecting insulin? How is sleep affecting cortisol? How is the barrier recovering after irritation? How is the body handling oxidative stress? When you ask those questions, magnesium becomes much more interesting. First, understand the inflammatory pathway. Acne is not just a plug in a pore, it is an immune conversation. The follicle becomes crowded with sebum, keratinocytes, and microbes, and then the immune system responds. Why do some pimples become small whiteheads while others become deep, painful nodules? Because the inflammatory response is not the same in every person, and the local immune reaction can amplify damage. A clinical review of acne vulgaris describes 4 major contributors: increased sebum secretion, abnormal follicular differentiation, follicular bacteria, and inflammation. Now ask, how can magnesium help here? Magnesium has been studied broadly for inflammatory and metabolic effects. A 2025 systematic review and meta-analysis in Frontiers in Nutrition examined randomized controlled trials of oral magnesium supplementation in people with metabolic syndrome and focused on inflammatory markers such as CRP, Illinois 6, TNF-alpha, nitric oxide, malondialdehyde, total antioxidant capacity, and glutathione. This is not an acne trial, so do not exaggerate it. But use the information carefully. It supports the idea that magnesium can participate in inflammatory regulation, and inflammation is one of the central engines of acne. Say it plainly. If acne is a fire, magnesium is not the firefighter with a hose. It is part of the wiring that helps prevent the alarm system from overreacting. That distinction matters. Do not oversell. Do not dismiss. Use it where it fits. Second, look at insulin and glycemic load. Why does a high glycemic diet worsen acne in some people? Because rapid glucose spikes can increase insulin and insulin-like growth factor signaling, which may influence androgen activity, sebum production, and follicular behavior. In a randomized, investigator-masked controlled trial, a high-protein, low-glycemic load diet improved acne-related biochemical parameters compared with a conventional high-glycemic load diet. The experimental diet reduced weight, reduced free androgen index, and increased insulin-like growth factor binding protein 1. Now connect the dots with care. Magnesium plays a role in glucose metabolism, and the NIH notes that diets higher in magnesium are associated with lower diabetes risk, possibly because magnesium is important in glucose handling. Hypomagnesemia may worsen insulin resistance or occur as a consequence of insulin resistance. How should you use this? Do not simply take magnesium and keep the same sugar-heavy routine. Pair it with a lower glycemic pattern. Choose pumpkin seeds, chia seeds, almonds, spinach, black beans, edamame, oats, and whole grains. The NIH lists these as meaningful magnesium sources, with pumpkin seeds, chia seeds, almonds, spinach, cashews, peanuts, shredded wheat, soy milk, and black beans among the examples. Give the body the mineral in the same package that nature often provides it: fiber, polyphenols, plant protein, and slower carbohydrates. Why is that powerful? Because you are not only adding magnesium, you are changing the metabolic signal that reaches the skin. Third, consider the skin barrier. Acne-prone skin is often attacked from both sides, internally by inflammation and externally by over-cleansing, harsh actives, picking, scrubbing, and repeated irritation. How many people make acne worse by trying to punish the skin into clarity? Too many. Stop doing that. Respect the barrier. A review on minerals in skin physiology notes that magnesium contributes to stratum corneum barrier formation and underlines magnesium's role in ATP-related metabolic processes. This matters because healing is energy demanding. The skin must shed correctly, repair micro-injury, regulate water, and rebuild structure. Magnesium participates in ATP biology. So ask, how can skin repair well if the body is underfed, underslept, overstressed, and low in key minerals? It may repair, but it may repair slowly, angrily, and unevenly. Fourth, look at oxidative stress. Acne lesions are not just bumps, they are inflamed microenvironments. Oxidative stress contributes to inflammatory signaling and tissue irritation. Magnesium is required for the synthesis of glutathione, one of the body's central antioxidant systems, according to the NIH. Do not make the mistake of thinking antioxidants are only found in colorful berries or green tea. The body also makes antioxidant defenses, and magnesium sits behind some of that cellular machinery. Why does that matter for acne? Because calming oxidative load may help lower the intensity of inflammatory signaling, even if it does not directly unclog a pore. Fifth, bring in the clinical acne-specific signal. In 2023, a single-blind randomized study in the Journal of Dietary Supplements evaluated adolescents with resistant acne using a combination that included magnesium, phosphate, omega-6 linoleic acid calcium salt, and omega-7 palmitoleic acid calcium salt, and compared it with isotretinoin over 6 months. The study reported complete regression of symptoms in the supplement group and a lower complete resolution rate in the isotretinoin group. Now be precise, because magnesium was combined with phosphate and fatty acids. The result cannot be credited to magnesium alone. Treat it as a clinical signal worth attention, not as final proof. Why is this signal fascinating? Because the formula did not only target inflammation. The authors noted that magnesium has anti-inflammatory properties, while linoleic and palmitoleic acids have bactericidal activity against Staphylococcus aureus and Cutibacterium acnes. That is a key lesson. Acne improves best when several pathways are addressed together: follicular plugging, inflammation, microbes, sebum, hormones, diet, sleep, and barrier integrity. Magnesium fits into that larger framework. Do not isolate it from the system. Sixth, apply magnesium wisely. Begin with food. Do that first. Build a magnesium-forward plate. Pumpkin seeds over yogurt or oatmeal, spinach in eggs or lentils, black beans in a bowl, almonds or cashews as a snack, chia seeds in a simple pudding, brown rice instead of refined grains, edamame with dinner. Why food first? Because food gives a steadier mineral pattern and brings fiber, which supports glycemic control. If supplementation is needed, be disciplined. Check the label for elemental magnesium, not just the compound weight. The NIH explains that supplement labels list elemental magnesium, and that forms such as citrate, lactate, chloride, and aspartate tend to have higher bioavailability than magnesium oxide and magnesium sulfate. Use modest dosing unless a clinician guides otherwise. The adult tolerable upper intake level for supplemental magnesium is 350 milligrams per day. This limit applies to supplements and medications, not magnesium naturally present in food. High supplemental doses can cause diarrhea, nausea, and abdominal cramping, and people with impaired kidney function are at higher risk of toxicity. Also, separate magnesium from certain medications. Why? Because magnesium can bind some antibiotics and reduce absorption. The NIH notes that magnesium can form complexes with tetracycline antibiotics, including doxycycline, and quinolone antibiotics, including ciprofloxacin and levofloxacin. These antibiotics should be taken at least 2 hours before or 4 to 6 hours after magnesium-containing supplements. This is especially important in acne because doxycycline and other tetracyclines are commonly used in dermatology. So do not casually combine supplements with acne prescriptions. Coordinate. Ask. Time them correctly. Now make the plan practical. For 8 to 12 weeks, do this. Keep your prescribed acne treatment consistent. Add magnesium-rich foods daily. Reduce high glycemic snacks and sweet drinks. Protect the skin barrier with a gentle cleanser and non-comedogenic moisturizer. Sleep on a regular schedule. Avoid picking. And if you supplement, stay within safe limits unless supervised. Why 8 to 12 weeks? Because acne lesions form below the surface before you see them, and skin needs time to show the result of internal and external changes. Track intelligently. Do not stare at the mirror every hour. Take photos once a week in the same lighting. Count painful lesions, not every tiny pore. Notice oiliness, redness, healing time, and premenstrual flares if relevant. How will you know magnesium is helping? You may see fewer inflamed lesions, calmer redness, better sleep, less stress reactivity, or improved recovery after breakouts. You may also see no change. If nothing improves, do not force the story. Acne is multifactorial, and some cases need benzoyl peroxide, topical retinoids, azelaic acid, hormonal therapy, antibiotics, isotretinoin, or evaluation for endocrine drivers. And remember this, magnesium is not a license to ignore severe acne. If acne is nodular, scarring, painful, widespread, or emotionally heavy, get dermatologic care early. Scars are easier to prevent than to revise. Act before inflammation leaves a permanent mark. So why magnesium? Because acne is not only a pore problem, it is an inflammatory, metabolic, hormonal, microbial, and barrier-related condition. Magnesium may support several of those layers at once. Inflammatory balance, glucose regulation, cellular energy, antioxidant defense, stress resilience, and barrier recovery. How should you use it? Use it as part of a structured plan, not as a miracle claim. Start with food. Supplement carefully if appropriate. Respect medication timing. Protect the skin barrier. Track outcomes over weeks, not days. Let this be the message. Do not fight acne with panic. Build a calmer internal environment and a smarter external routine. Give the skin fewer reasons to overreact and give the body better materials to repair. Take care of yourself, take care of each other, and keep learning as one community. I'll see you with the next topic, like family meeting again around the same table.